I'll be answering some commonly asked questions about dental school. I am currently a Year 2 dentistry student in Trinity College, Dublin, Ireland, and I am from Singapore, which means that I am an international student in Ireland. I hope that these questions will be useful because they are some of the questions that I had when I was preparing to enter dental school and when I was writing my applications for dental school too. So let's get started. Okay, so the first question is, why dentistry? Why do you choose to study dentistry? And this is a common interview question also. So interviewers will always be asking you, why do you choose to study dentistry? Why do you choose to study dentistry over medicine? They're always asking this. And for me, my uncensored answer, my non-politically correct answer that I don't say for interviews is that I really like teeth. And I'm really interested in teeth, and I could stare at teeth all day long and not be bored. This is the main reason why I chose to study dentistry, because I knew that I had an obsession over teeth already, and this may sound weird, but my friends always say that I'm always looking at people's teeth and analysing it. And so for me, the choice was quite clear. I really wanted to be a dentist from very long ago, and there was no debate between medicine and dentistry for me because I was only interested in teeth. Okay, so the second question is, why TCD? Why did you choose to study at Trinity College, Dublin? Okay, so honestly, my first choice was not to study in TCD. I wanted to study in Singapore, in the National University of Singapore. But then at that time, the dentistry slots were really competitive, and they only took in around 50 to 60 students a year. So I had to be prepared in case I didn't get into NUS. So before I applied to NUS, I also applied to UK, Australia, and Ireland. And in the end, I really didn't get into NUS. So thankfully, I applied to other schools overseas also, so I had backup plans. The reason why I chose TCD over studying in UK was because of the 1-year vocational training that you had to do in UK after graduating, after your 5-year course, in order to work in the UK. And I didn't want to do that 1-year vocational training in order to work in the UK. For Ireland, you don't have to do that 1-year vocational training, so that was a plus point for me. And also for Ireland, the results came out earlier than the schools that I applied for in Australia. So it was a natural choice for me to choose Ireland. And also, I knew a dentist that studied in TCD and then graduated and was working as a dentist in Singapore. And I also knew other dental graduates who were from TCD, so I thought that it would be a safe choice to come to TCD and work in Singapore in the future. So yeah, that's the main reasons why I chose to study in TCD. The next question is, what is your favourite part of dental school? Okay, I'm only in year 2, but then right now my favourite part of dental school is the hands-on part. So I really enjoy working in the lab and in the clinics compared to sitting in front of my computer and just studying straight out of a textbook or from my notes, because I feel like it's so interesting to actually hold all your tools and hold all your instruments and sit there either in the lab when you work on a mannequin head or in the clinic where you work on your real patient, who is currently my partner because we don't have real patients yet, and just like do the hands-on work. So yeah, that's my favorite part of dental school. And my least favorite part of dental school is learning biochemistry and physiology and all the other topics that seemingly have no relation to whatever goes on in the mouth, but it's related to systemic health, and so we have to learn. So like in dental school, you don't just learn about the teeth and the gums and the tongue and the mouth. You have to learn about other parts of the body also and how your body functions as a system. And because I don't really like learning about these kind of things, I really dread it when we have to learn it, and memorizing it is really hard for me also. So yeah, I don't really like that, and I wish that we had more hands-on work instead of learning about those things. But unfortunately, we do have to know them because we are treating the patient and we are healthcare professionals, so all this knowledge is really important to us. The next question is it possible to have a life outside of dental school, and how? Okay, so I think it's a common misconception that people studying medicine, dentistry and law are always constantly studying 24/7 and have much less free time to themselves compared to people studying other courses. So that's true, we do have less free time, but it's totally possible to have a life outside of school as long as you manage your time well and you take care of yourself. So for me, I'm personally not sporty, but I still have time to engage in my other hobbies such as making YouTube videos and like going out to eat and going out to shop and spending time with my friends and my housemates. And if you're sporty, I do know of people in my course who play sports competitively. We even have a sports scholar in our batch, so I would say that that's definitely possible. And I think that as you progress through the years, your workload will get heavier and heavier, so there'll be less time for you to do the things that you enjoy. Right now, as long as you manage your time properly and you allocate time to enjoy yourself and not be immersed in your schoolwork all the time, it is possible to have a life outside of dental school. Okay, so the next question is something that I wish was different about my university's teaching. So I have my lessons, labs, and clinics all in the Dublin Dental University Hospital, which we call DDUH. And I wish that in year one we were given more opportunity to do dentistry related things, because in year one we were forever just learning about basic sciences and anatomy, and we didn't really have a chance to do dentistry related things like touch the instruments in the lab, learn what the instruments were, and the only times we went to the clinic were to observe our seniors doing dental work on their patients. And I feel like year one is very important to be exposed to dentistry related things, so that you know if you like the course, and if you don't like it, then you can quit and not waste your time in a course that you don't like. Because if you only start doing dentistry related things in year two and you realize you don't like it, then you have already wasted your whole year one. So yeah, I wish that our school could have exposed us more to dentistry related things in year one. Okay, so now moving on to advice. To those unsure about whether they want to study dentistry, how should you decide? Okay, so for me personally, I was very sure that I wanted to study dentistry already, just because I was interested in teeth and because I thought being a dentist, based on my dental visits to the dental office, was something that I wanted to do. But if you're unsure, you should definitely go for a dental internship. So I did a dental internship in Singapore, and that dental internship really strengthened my drive to study dentistry, because I stayed there for 7 months and I was very convinced and very sure by the end of it that I wanted to be a dentist, because I had seen all the good parts and bad parts of being a dentist, of treating patients, of running a dental office. And after seeing all that, I was still very interested and still very sure that I wanted to do dentistry. So I would say that a dental internship is very helpful, but only do it if it's at least a month long, because I feel that week-long or 2-week-long internships are not enough for you to get the full experience and let you see the good parts and the bad parts of being a dentist. So yes, a dental internship will definitely help. And also, I recommend talking to dentists. You can just talk to your family dentist and ask him or her for advice. And also, you may want to talk to your seniors who are studying in the schools that you want to apply to about how their dental school experience is like, because different schools have different teaching styles, and whatever I say in my videos may not apply to other dental schools around the world. And if you're having difficulty finding seniors to talk to, then just message the Instagram accounts of like SMS UK or like SMSI. Those are the Singapore Medical Society UK and Singapore Medical Society Ireland, and they'll definitely give you some good advice. Even if you're not Singaporean, I'm sure that you can message them, because they'll be more than happy to answer your questions. Yeah, I know I'll be more than happy to answer your questions. And another question is, how do I know that I'll be good at dentistry? How do I know that this is the course for me and that I won't be the slowest in my class, or I won't be bad at doing dental procedures? So in dentistry, they always like to talk about manual dexterity, and they like it when you're dexterous and you're good with your hands. Personally, I wouldn't call myself a dexterous person. I feel that I'm quite clumsy and I do take a long time to learn things. So if you watch my previous vlogs, you would know that I'm struggling in the lab right now, and sometimes I cannot do the dental procedures properly because I'm very slow or I'm just clumsy. And when I ask my seniors, like, do you think I will have a problem in dental school because I'm not dexterous? All of them had the same answer, and that is, you may be slower at the start, but dexterity is something that you can learn and you can practice, and over time you get better and better at it. So your worry about not being dexterous should not stop you from becoming a dentist. And I think that's a really good piece of advice, because in dental school they really teach you how to use different techniques to stabilize your hand, and how to make sure that you don't shake when you're holding your instrument, and how to make sure that you're doing the procedure properly. So yes, if you have hobbies such as making clay models, or like sewing or knitting, or like playing musical instruments, then you would definitely have a higher level of dexterity than your other peers. But even if you don't do any of these, manual dexterity is not a concern, and it can always be learned and practiced. So don't worry about that. And for the studying aspect, if you're unsure about whether you can cope with the workload and with all the things that you need to memorize, well, I'm also not a very good memorizer or very good at studying either, but I'm still coping. And I think it's just like your passion for dentistry that pushes you to just work hard and do whatever you can to pass the year, because you know that at the end of this, you want to achieve your end goal, which is to become a dentist, and so you'll be naturally motivated to do your best in school. So yeah, if you're passionate about dentistry but you're not sure whether you're good at it or not, I would just encourage you to go for it, because that's what I did. And the last thing I want to talk about is just something that I wish someone had told me before I started dental school. So I really wish that someone had told me that in dental school we would not just be studying dentistry, we would be studying biochemistry, physiology, anatomy, and a whole lot of other things, because I think when you enter dental school and you realize that you have to know all of this, it can be a bit overwhelming, and I would have liked someone to warn me about it first, but it's okay, like you just get used to it and you just memorize it all anyways. So yeah, that was the main thing that I wish someone had told me. But other than that, I think I've been blessed with really good seniors in dental school and really supportive friends that are in my batch. So dental school has been pretty fun. So yeah, I've been very lucky. Okay, so that's all for this Q&A. I hope that it was useful and that it answered all your questions or the main questions that you had about dental school. And before I end this vlog, I just want to say that I'm very thankful for all the support that I've received in my previous video and my other videos that I did about dental school. Sometimes it gets a bit tiring when I have to vlog and edit my videos, but then when people message me to tell me that they enjoy my videos, or when I'm asked when is my next video coming out, I get very happy and very excited. So yeah, thank you for the support, I really appreciate it. And yeah, okay, have a good week. Bye.